Good evening. I am Victoria from Get the Gloss. Welcome to this Get the Gloss Masterclass, all about aging well and managing breakouts, two skincare biggies. And there's no one who knows more about this than Dr. Stefanie Williams, and she's here with us this evening. Welcome, Stefanie.
Hello, good evening.
Good evening.
Thanks
How are
me,
you?
Victoria.
How are you?
I'm good. How are you?
Good, good. How's the clinic been today? You're joining us live from your clinic, I think.
Yes, busy day as usual. I think November is always a very busy month because people are getting ready for Christmas. And yeah, it's a kind of mix usually of medical and cosmetics patients I see in clinic.
Yeah. What are people asking for generally just before Christmas?
Really much of the same, I would say. It's just that people really try to sort their skin out. So cosmetic treatments, I mean, you know, the typical things, improvement of skin quality, Botox, fillers, but also, yeah, I see a lot of patients with breakouts, and I have for over 20 years, and that's my special interest, really.
Yeah.
And yeah, that is an increasing problem, especially with mask wearing these days, that women, even in their 30s or 40s or 50s, still suffer with breakouts. And of course, have the other issues as well, you know, as all of us, wanting to prevent aging or treat aging. And it's a very tricky combination, but that's my kind of special
speciality. I know. And actually, it's really quite rare to come across somebody who can treat the two together, because as we'll find out in this 45 minutes to an hour that we're going to spend with Stefanie, asking her all the questions that we were about aging and about managing the kind of little hiccups in our skin that well, or big hiccups that that can happen at any stage of life. So just a little bit of housekeeping for everyone. We are going to be here for the next 45 minutes to an hour, and we'd love to hear as many of your questions to Stefanie as possible. Stefanie's going to be doing a bit of presentation, telling you a little bit about the Delo RX that I hope is fantastic. Treatment cleanser. I've never even heard of a treatment cleanser. This is really quite groundbreaking, that hopefully you've all received in your goodie bags. If you haven't, it's on its way imminently. And so she'll be doing a presentation, but please put your questions in the chat. We'll be chatting as we go. We want to make it really interactive. Let us know your skincare concerns. And if you have any questions for Stefanie, she's here to answer. There will be a chance for questions at the end too.
Yeah.
So
thank you, Victoria.
Oh, no problem. I'd love to know from people, please do put any of your skincare concerns in the chat. I'd love to know, what are the major things that come up for you? Are there any specific concerns that you're feeling this time of year or this time of life? Anything that has come up? Certainly, yes. Oh, Shimer has already said, yes, I have a few concerns. Great, put them in. Certainly for me, I know I had like the hormone, definitely more hormonal chin spots, never having had spots before. So I'm sure a few people have experienced that. But I'm going to hand over to you now, Stefanie. I'm going to disappear and enjoy your evening, everyone. By the way, we will send you a recording of this, so don't worry about remembering anything, taking notes. Sit back, enjoy, and I'll hand you over to Stefanie.
Thank you. So please do put any questions into the chat. We will keep looking intermittently. And the other thing, if you feel comfortable, it would be really useful also to know your age. So when you put any questions about your skin concerns, and if you feel happy to do so, if you mention your age as well, that really puts it in context then. Because adult breakouts are very distinctly different from teenage breakouts or early 20s breakouts. So I'm just going to share my screen now, and I will give you an overview initially of about skin aging and breakouts as well. So those two things, it's the combination really. So adult breakouts, so people who still suffer or maybe newly suffer with breakouts such as acne or rosacea, but also, of course, want to prevent or treat signs of aging. And that's very personal to myself as well, because I am myself 50 years old. I do suffer with both adult acne and rosacea. So I know from personal experience that that's a very tricky combination. So I'm going to start just briefly talking about myself so that you know who you're talking to today. So I'm a dermatologist and I'm the medical director of Udelo Dermatology and Skin Wellbeing. This is our clinic. On the top, you see the waiting area. And this is my team. So there are 4 dermatologists, a couple of cosmetic doctors, and then a group of therapists as well. And we are one of the very few fusion clinics of medical and cosmetic dermatology. So we really cover the entire spectrum of what could go wrong with your skin or just optimizing your skin. And I'm also the author of this book, which you will receive or which you have received already in your goodie bag. And it's called Look Great and Not Done. I wrote this book because I see so many people just being on the tube, but also seeing me as patients who look terribly mistreated. And then, of course, a lot of people who could really benefit from cosmetic treatments then are scared to do this because they've seen all these really bad examples just in everyday life, as I have. But that doesn't have to be the case. It's purely in how it's done and that it's not overdone. So really, really important that people don't have to be scared of looking obvious. We're just really turning back the clock. We're not making you look weird in any way. And the key to that approach, which you will see in much more detail described in my book, is the Udelo system that we use in clinic. And it is based on 3 main principles. And I'm just going to briefly mention those. So that's the 3 key principles, the foundation principle and the staircase principle. So if we're starting with the first, which is what patients come most commonly to see me in clinic with when they're starting on their journey of optimizing their skin. And that's wrinkles, lines, and furrows. And although this is the most commonly reported concern, it is, in my opinion, actually not the most important. Of course, we can reduce all of those, but I think to achieve the aim of looking the best version of yourself and looking fresh and glowing, there is a much more important aspect. And that's the second key. This is very often overlooked, but less so increasingly, which is great. So that's skin quality and skin health. So skin quality are things like firmness of the skin, elasticity of the skin, pore size, also pigmentation, irregular pigmentation, and then skin health issues, really, really important, because I often see patients coming into clinic to come and see me for cosmetic treatments. And then when I examine them, they actually have skin health issues. So that might be breakouts or any other kind of skin health issue. And that has to always come first. So skin health issues have to be sorted first, and then we go into optimizing the skin and helping you to look your very best. So that's the key number 2. And then the third key is something that I think causes quite a bit of anxiety in a lot of people, because this is the area where people often go wrong. But as I mentioned, it doesn't have to be the case. Before I come to the last key, though, I just want to show you a few before and after images from clinics. So this is somebody I've treated with adult acne, 39-year-old lady. And you can see, and the right, by the way, is not airbrushed or with makeup, completely a makeup-free face on the right. And you can see what a huge difference it makes to just clear breakouts, really. And then I mentioned, or I might have not mentioned, but definitely acne scarring is a biggie. So enlarged pores, depressed scars, irregular pigmentation, after breakouts, or just on its own, really, really important to sort out. And then I mentioned the loss of elasticity. So there's no specific skin health concern here, but it's just the issue of skin aging with you know, the visible loss of elasticity and crepiness that you often see creeping in with age. And again, that is something that we can treat quite easily. Irregular pigmentation, I mentioned. This is a patient with melasma before and after treatment. This was after a treatment in clinic that's called a mela out, which is highly effective. What I wanted to mention, though, is that this is not about lightening the skin. So I think this is important to really remind ourselves that we are not in the business of skin lightening. We want to create an even skin tone, whatever your skin tone is, because science has shown that irregular pigmentation, patchy pigmentation, does lead to people judging you not only as less attractive, but also as less healthy, actually. There are a couple of psychology studies on this, which are very interesting. So we want to achieve an even skin tone, like here. And now I'm coming to the third key, and that's the facial volume and contour. That's a really, really important key when looking to turn back the clock, so to say, and making you look the very best version of yourself. And that's because what happens when we age, so this is a young woman, and in youth, we've got this triangle of youth. So we've got good volume in our mid-face, we've got plump cheeks, and we've got no heaviness in the lower face. So it's this kind of upside down triangle of youth. And then when we get older, this is what happens. So this triangle inverts into the aging face triangle. And what you can see is that the mid-face loses volume. So the fat tissue in your cheeks goes down, but also the bone volume, which I will show you in a second. And then with gravity, everything sinks down. So you've got less volume in the mid-face, and you've got a heaviness in the lower face and the jawline area in particular, with jowls and so on. And as I mentioned, it's not only the fat tissue that actually goes, but it's even the bone that resorbs as we age. So you can see here what happens when we get older. And sadly, the maximum bone volume we reach age 30. So beyond age 30, we are declining in bone volume. So it's really quite early that that happens. And what happens then is that you can see here, this is a scan of a young woman and an older woman. And what I just showed you in that drawing, you can actually see in this scan here that the orbiter, hole gets bigger, the jaw retracts, the cheekbones get smaller as well. So when the underpinning of the skin, so the scaffolding of the skin gets smaller, both with fat volume loss and bone loss, and the skin size stays the same, what happens is then that the skin envelope is simply too big. And that leads with gravity to sagging, lines, furrows, and so on. So what we want to do is really restore the lost volume in addition to treating firmness and elasticity of the skin. And we can do that quite easily by just supporting very strategic areas of your face. So if you imagine you've got a coat hanging on a coat hanger, it will look really saggy and wrinkly, essentially. And if you just support this coat in two single areas, so under the shoulders, you can not only reduce the wrinkliness of the coat, but you can also really restore the contours of the coat. And exactly the same is what happens with the face when we do a full face contouring treatment. So very small volumes, so you will not look overdone, but in very strategic areas, so that the scaffolding that holds up the skin envelope then gives that skin envelope a much better support structure underneath. This is a photo on the right side. You can see that the patient has really lost mid-face volume. So you can see the loss of fat tissue and maybe resorption of the cheekbone as well. And then on the left, this is where I have restored some cheek volume in a very natural looking way. And of course, then we did the other side as well. And it's not only the cheeks that lose volume and the temples, of course, but also our lips. So our lips lose volume and deflate as we get older. And that leads not only to smaller lips, but also to lipstick bleed lines, both on the lips as well as around the lips as well. And you can see here, this is a lady out treated with the lip smoothie treatment, where we replace that lost volume both inside the lips as well as around the lips, and it looks completely natural. And one of my pet hates is really seeing overdone looking people. And as I just want to reassure you again, that absolutely does not have to be the case. And the other thing that's important to remember is that it's much easier if you start early and with really, really tiny treatments compared to starting late, and then it gets much more difficult to achieve a natural result. So it's much easier to kind of drip feed over the years rather than to have to do some big intervention. Volume loss can, of course, also be genetic, like in this N30s patient who just genetically had a really fleeting chin, and she always had that her whole life, and it really bothered her. And by just restoring a much more balanced profile of the face, it makes this patient look much more attractive. And in fact, I had another patient I just treated very recently who said that she, since her childhood, she never ever wore her hair back in a ponytail. She always wears her hair down because she has a little bit of fleeting chin and she really didn't like the facial shape. And then when I treated her chin, very similar to the photos we just saw, she now for the first time in her whole life loves to wear her hair back and to really show off the facial shape. And that's just really rewarding to see that change in a patient. And this is to summarize those three principles and the three keys, the three key principles of our three principles. So it's skin quality and skin health, very, very important. Facial volume and contour, and then the cherry on the cake, so to say, is treating lines, wrinkles, and furrows. So it's really important to do the right order. And then the second principle is the foundation principle. And what I mean when I say that is, if we imagine our face as a house and we would just do corrective treatments, so treatments like fillers and Botox, and I'm sure you've seen that in celebrities, that they look really amazing and much younger than their chronological age for a long time, and all of a sudden their face kind of collapses in a way. And that happens because we haven't symbolically put a foundation there when thinking about treatments. So if we just do corrective treatments without really putting a foundation, then this is what might happen. And what I mean when I say foundation with regards to treatments, this is actually will become clearer on the next slide, but it's regenerative treatments to really stimulate your collagen production and to really make your cells behave like younger cells rather than just painting over the cracks. So regenerative treatments, skincare also comes into this, because if you use the right skincare, that makes a huge difference over time. And the third principle is the staircase principle. And this is where skincare comes in. And I'll come back to that in a moment. But before actually, let me just come back. Where's my staircase gone, actually? So I think there is a slide missing, but I will just talk you through it. In fact, I'll come out of my slides and then we can ask some questions and answer some questions as well while we are out of the slides. So basically the staircase principle means that when you're thinking about anti-aging treatments, that you stick to a certain order. So what you want to do first is think about your lifestyle choices. So you don't want to have a really unhealthy lifestyle with smoking like a chimney, sunbathing until you're crisp, really unhealthy diet, loads of urban pollution exposure, and then go for your cosmetic treatments, because that doesn't make any sense. You really want to put that foundation in. So the first step is lifestyle. Second step is skincare. So really active cosmeceutical skincare, really, really important. The third step are regenerative treatments. And then only on top of that comes the corrective treatments. And what I always say to patients is that how far you step up on your imaginary staircase completely depends on your personal preference. Some people don't want injections, and that's absolutely fine. But what you should never do is skip a step. So you can't go up to the injections without having good skincare and having your monthly regenerative treatments.
That's
so
really
that's the first principle.
That's really interesting, Stefanie, that you say that, because that makes sort of looking after our skin and managing our issues kind of accessible for everybody, because everybody starts from the same principle. You know, like you were saying, people come to you with for injectables with unhealthy skin, and you have to start them from the bottom. So yeah, that's really fascinating. And some of those results were incredible. I mean, the sagging one, I was looking, I was like, oh, that is really interesting. When you say the regenerative treatments before the corrective ones, what does that involve?
So these are the treatments. So they're in-clinic treatments, but they're treatments that make your skin behave like a younger skin.
Yeah.
So we're changing your skin's biology back to that of a younger skin. So we are not just, filling up lines or reducing mimic lines by reducing the over movement, but that might be, for example, there are a variety of medical needling procedures that can really stimulate collagen, like exocrine needling or PRP needling.
Yeah,
they are great for doing that, for example.
Yeah.
Or if you wanted something without any down, there are some really active facials as well that incorporate maybe peels, maybe a plasma peel. So all of these regenerative treatments really help the skin to help itself on a cellular level, rather than just correcting what's visible, but keeping the skin biology unchanged.
That was something I actually only learned this year, that peels, I thought they were just for exfoliating, but they actually do have collagen stimulating benefits, don't they? We've got a few questions in the chat. These might be something you want to address as you go, but I'll Shamar is asking, what key ingredients should you look for and what age should you start? You said start young, looking after your skin. Natasha's saying she's looking for tips for rosacea and breakouts. She's 39, and James is 30 with combination skin with acne and very dehydrated skin. So this kind of multiple concerns going on.
Yes. And that's very interesting, because you are certainly not on your own. So I mentioned earlier briefly that teenage breakouts are very different from adult breakouts, because teenage breakouts usually come with really oily skin, and with that a lot of congestion and really quite robust skin. So we can use ingredients that are quite harsh and often are stripping the skin of oils, which is not the best thing to do anyway, but that's often the treatment, the classic treatment for breakouts. But once you're an adult and you still suffer with breakouts, that becomes even worse because your skin typically is less oily, more sensitive. So I'll come back to ingredients in a minute, actually. But generally, we have to be much more careful and much more on the anti-inflammatory mechanism of action rather than stripping away oils, because for adult breakouts, that just makes things worse. You just end up feeling very irritated, and yeah, it's a different mechanism of action. And I'll speak about ingredients in a moment as well. And just one more thing I wanted to mention before we speak about ingredients actually is if you suffer with breakouts and you going to a clinic to have one of those treatments, so any one of those cosmetic treatments, whether that's regenerative or corrective, it's really important that your practitioner, and it depends if you go to a medical clinic, and this is if you have breakouts, I would recommend that you go to a medical clinic who offers both medical and cosmetic dermatology, because what you often need is a much better covering of your, not covering as in makeup, but making sure that you're not breaking out while you're having the treatments. Because if you, for example, have a medical needling treatment and you have a tendency for breakouts, then chances are that this treatment will really make you break out. So that's key, that our patients who come for example, for cosmetic treatments, but have a breakout history, they tend to see a dermatologist first to get the breakouts under control. And then while they have a treatment, we might even temporarily put them on some, for example, some acne antibiotics, so that we are absolutely sure that when they are having the cosmetic treatment, that they're not breaking out. So that's quite important to know, that there are ways of preventing breakouts when you have cosmetic treatments.
There's a question from Samira about the regenerative. We were just talking about the regenerative treatments. Cosmetic acupuncture, facial acupuncture, could that be one of the regenerative steps you could take? It is a kind of needling, I guess.
Well, it's a different type of needling. So needling in the classics, in kind of our medical sense, is where you create like tens of thousands of punctures so that your skin is tricked into thinking there are tens of thousands of wounds to repair, and it will respond with tiny little wound repairing responses, including collagen, elastin stimulation all over the face. So that's a very different mechanism of action to cosmetic acupuncture. I'm a big fan of holistic approach, actually. So I would say medical acupuncture or cosmetic acupuncture is a great addition. Very different mechanism of action, but absolutely, I really am a big fan of addressing the skin and the health of the skin and the health of the body in general from all angles. So the needles in acupuncture do not elicit this wound healing response that medical needling does, but it has other effects, you know, on energy flow. And I'm not an acupuncture specialist, but I would certainly say that could be a good addition. It doesn't replace medical needling, but you know, if this is something you're doing, absolutely, why not?
Brilliant, brilliant. We've got a few questions about ingredients, and I know you're going to go on to talk about that. Nadia's asking skincare ingredients for under eye hollows. Can it be? Can skincare help? And I'm sure we'll come on to that.
Actually, let me ask that first before I forget, because that's a really common question I get. So under eye hollows, or sometimes patients call it dark circles, and sometimes it is a dark circle, i.e. pigmentation, which can respond to skincare quite well. Sometimes it's a mix of pigmentation and a kind of purple discoloration, which happens when you've got a leakage of hemosiderin into the skin, because your vessels are a little bit leaky in this area, and your skin under the eyes is very thin. So the hemosiderin shines through, and you see that as...
What is that, sorry? Hemosiderin?
It's part of your red blood cells.
Okay.
And sometimes they can leak into the tissue. And if you've got very thin overlying skin, then you see that as a purple discoloration.
Yeah, okay. And is that something to be
and
concerned
often it's
about?
a mix of pigmentation and purple discoloration. So that responds, and that can definitely respond to skincare. But if you have really hollows, which means the tear trough, this is where it goes, just there. And in fact, it's a shame I didn't put that photo in my presentation, but I had genetically extremely deep tear troughs. I always had it as on photos of me as a 3-year-old already. I have a very, very deep trough here. And then, of course, if you have a depression, the light doesn't reflect as well, and then it looks darker as well.
Oh, interesting.
This does not respond to skincare, sadly. But there is a really, really amazing in-clinic treatment for that, and which I had as well. And you can see that my deep tear trough has lifted really nicely, is a skin booster injection. So how that works is that you have a numbing cream first, so it's completely painless. And then we inject tiny little droplets of hyaluronic acid, not quite as firm as a filler, a little bit more liquid, but the same kind of sterile type hyaluronic acid gel. And that lifts the tear trough. So if it's really the hollow, then I would say you need an in-clinic treatment. If it's just a dark circle, then skincare can help with that.
Would that be Profilo, Stefanie, the booster that you're talking about, or is that something else?
No, Profilo is contraindicated under the eye. Profilo we inject into certain other areas like here, there. It's a great treatment, but under the eye, what I use there is it's a product called Restylane Vital Light Sample. That's one of my favorites for under the eyes. So that's a
and how long would that last?
Swedish hyaluronic acid.
How long would that last?
Under the eyes, you have very little. Sorry, yes. Under the eyes, you've got very little of this enzyme called hyaluronidase that breaks down your collagen. So that's a good thing in a way, because once you have achieved the desired result, which might be 1 session or maybe 2 sessions, the result lasts 1 to 2 years. So it's a really good duration actually for that.
Yeah, that's quite good bang for your buck. I don't know if you want to tackle some of the other questions. We're gonna go to talk about rosacea, are we?
Okay. Yes, we are going to talk about rosacea.
Okay.
Talk about rosacea.
Right. We'll
so maybe what we should do
Natasha, your question will be answered then. Tips for rosacea and breakouts, and key ingredients for dry skin, well, which is obviously your skin that gets drier as it gets older, and dry skin looks wrinkly. So I guess that is
true. However, a word of warning, if you are breakout prone, chances are that it's not really dry skin, but it's a sign of microinflammation in the skin. That is the case very often, especially for rosacea prone skin, but also a lot of acne, adult acne cases. So the key here is if you have breakouts, you mustn't overcare your skin with, very lipid-rich creams and products, because that would make your breakouts worse. Yeah. What we have to do is treat the microinflammation, and then you'll have less need to use thick products and rich products, because they would just make you break out more. Yeah. So this is a very, very common misconception actually. And I will come back to that in a minute as well.
Yeah, James is saying he has combination skin that's very dehydrated with acne, and I guess you think, well, dehydrated, I need to moisturize it heavily. Yes. Acne, I need to kind of lay off the heavier creams. What would be the solution for that?
Yeah, so really important not to overload the skin. So anti-inflammatory creams, I'll talk a little bit about some over-the-counter ingredients, but if that's not enough, you might need prescription anti-inflammatory creams. And I'm not talking about steroids, by the way. They're of course not suitable for breakouts. And then you will not have that feeling of hydration so much, because if you are suffering with breakouts, then you can't overload the skin with lipid-rich creams. That would just be completely contraindicated.
Yeah.
What I would say is I'll just talk about the other, through the other slides, because I think a lot of things will become clearer there. And then we come back to the questions, and we can, if something hasn't been mentioned, then we will answer that afterwards. So can you see my screen again?
Yeah.
Great. So I just wanted to briefly mention that adult breakouts is really a very common issue. And in women, for example, 40 to 50% are estimated from studies to suffer with breakouts. And this is increasing, and certainly masks don't help that matter, sadly. And a lot of these adult women also have sensitive skin at the same time. And of course, if you're a certain age, you will want to prevent or treat signs of aging. So this is a really, really tricky a combination of issues there. And also I wanted to say that breakouts are not a rite of passage, and breakouts shouldn't be accepted as one of those things, because we know how psychologically damaging breakouts are. And this is interestingly actually unrelated to the severity of your breakout. So how much psychologically you are impaired by the breakouts does not necessarily is not necessarily related to how severe the breakouts are. And when I talk about breakout prone here, I'm not only talking really about the severe cases that we think about maybe when we say acne or when we say rosacea, but even if you just have, say, premenstrually a couple of spots every month, this is still breakout prone skin. And this is still a skin that needs a special type of skincare. And if you suffer with breakouts into your adult years, there are 3 conditions that are mainly causing this. The first one of these is adult acne. So that's one of the 2 most common ones. And you've got the inflamed lesions, which might be these deep, painful red pustules and papules. Often in adults, it moves down from the T-zone into the lower face, maybe along the jawline, chin area. And you also have non-inflammatory lesions, which are blackheads and whiteheads. And every single one of these spots we call acne, just to be clear. This is just a medical name for a spot, basically. So acne is no judgment on severity at all. And of course, we know that acne can scar permanently, so very important to treat early. The second of the 2 most common conditions to cause breakouts in adults is rosacea, especially in fair skin, but can occur in any skin, darker skin types, most commonly in middle-aged, and most commonly in female skin, but again, can appear in any skin type, any age, any gender. And this is what I mentioned earlier. So you feel, the vast majority will feel they've got dry skin, but this is not true dryness. This is microinflammation that makes your skin feel dry. And then sometimes that can be associated with an increased number of Demodex mites in the skin. So these are little mites we all have on our skin, but rosacea sufferers have maybe a little bit more in number, and they're also overreacting to one of the byproducts of these Demodex mites. So skin in rosacea is often sensitive, or described as sensitive, described as dry or dehydrated, and very reactive, can respond with stinging to skincare, very responsive to environmental factors as well, sun, heat, alcohol, spicy food. And of course, you might suffer with both, as I do as well. So I have a tendency for both adult acne and rosacea.
And
Stephanie,
a friend of mine who is 50 says she has just been diagnosed with rosacea. Is that quite common to develop it as you get older? And why might that be?
Yes, very much. So acne is sometimes that you may carry with you from teenage years, or you develop newly midlife. But rosacea is typically something that you don't have as a young person. So you really typically develop this It can be sometimes in the 30s, more often in your 40s, or sometimes in the 50s as well. So this is very, very common that rosacea sufferers tell me, I always had great skin. I just don't get it. Now I'm 40, now I'm 50, suddenly I break out in spots. Very typical history, actually. And we don't know why that's the case, but it is a very typical history. And this is the third condition, the POD. The old name is perioral dermatitis, but it should really be called periorificial dermatitis, which means a rash around openings. So it can be the mouth, the nose, the eyes, very occasionally genital areas, but mostly the mouth and the nose, really. And this skin also feels really dry and feels uncomfortable, or even shows flaking sometimes. And it's very often misdiagnosed as eczema or acne. And then if it is misdiagnosed as eczema, what happens sadly is that your GP might prescribe a steroid cream, and that will mask your POD, but it will make it way worse medium to long term. And if you then come off the steroid cream, then you've got this massive rebound phenomenon where your skin really explodes, or your rash really explodes. So that's an unfortunate thing that sometimes happens. And POD is caused usually by an overcaring of the skin. So using too rich skincare products, oils, balm cleansers, these kinds of things. So again, we have to really treat the skin with an anti-inflammatory cream, or in severe cases, tablet. And then we don't have that need for overcaring for the skin so much, because generally moisturizers are overused these days. I have to say, I see that every week in clinic, because we constantly have this brainwashing of moisturize, 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 and people just use too much, and they are dulling their skin. They're well, suffocating their skin, making it lazy in a way also. So the skin doesn't really produce as many moisture holding factors on its own anymore.
That's really interesting. I think I'm definitely guilty of that, over moisturizing, because your skin does feel dry, and 4 o'clock in the afternoon I have to pile it on.
And you will make that worse if you do that. Sorry to say that,
oh,
but
absolutely. That's why we've got the doctor here.
So what you do then, if you just stick down those the flakes that you might notice, if you apply something really rich, you just flake them, you just stick them down, but you're not helping the skin to exfoliate those dead skin cells that make it look flaky.
Yeah. For me, it's a problem. It's kind of an uncomfortable feeling of dryness. So I don't get the flaking. It's more the need to relieve.
Which might be microinflammation, actually. That feeling of uncomfortable dryness is very often microinflammation.
Stefanie, James is asking, at some point, could you share your skincare routine?
Yes.
On your...
You mean my personal one?
Yes, because you mentioned you had some of these issues.
Yes, absolutely. You know what, I'll just finish talking about this, and then I'll come out of the slides again, and then we'll come back to the questions. So as a general principle, if you have breakouts, by all means, unless they're scarring or very severe, by all means, try over-the-counter options first. But if it hasn't really responded or cleared after about 3 to 6 months, then you do need to see a doctor, and that's a sign that you do need prescription creams, or in more severe cases, tablets as well. And then one word of advice on scarring treatment in acne and laser or IPL treatment in rosacea for broken vessels. So these things can only be addressed once your breakouts are clear. So if you still suffer with breakouts, we cannot treat your scarring, or we mustn't, we shouldn't. And we can't treat your vessels either for rosacea. So breakouts first. In fact, I will go on and just talk about my products, because a lot of the questions will be answered with this, and then we come out and do questions at the end, if that's okay. So these are some of the ingredients that help with breakouts. And tea tree oil, just note here that I crossed that out. It's not a good option for breakouts. Yes, it does have mild antibacterial effects, but the disadvantages of using that oil on your skin way outweigh the mild anti-inflammatory and anti-bacterial effects. These, however, are 3 of my top ingredients for somebody with breakouts and aging concerns, because they help with both. These are retinoids, and there's various retinoids available, of course, polyhydroxy acids, such as lactobionic acid and gluconolactone. And that's because the AHAs are, in adult breakout skin, often a little bit too harsh. So the polyhydroxy acids are more gentle to the skin. And then one of the unsung heroes, I would say, is NAG, because that helps with both aging and breakouts as well, without irritation.
I've never heard of NAG.
Yes, it's a really underrated ingredient, very underrated ingredient. There's some skincare out already that contain that. For example, well, my upcoming retinoid, no, sorry, the moisturizer will contain NAG as well. That's not quite out yet. So in the meantime, for example, the Neostrata retinol NAG, that contains both a retinoid and an NAG ingredient as well. And then once my product comes out, then of course that will be another choice.
When is that, Stefanie? When can we look forward to that?
So the retinoid will be launched in Q1 of 2022, next year. And then this anti-inflammatory moisturizer will be Q2, sorry.
Yeah, so Easter time-ish.
Yeah, hopefully.
Oh,
there's at the moment a lot of supply issues, unfortunately. So, but that's the timescale we're working towards at the moment. But apart from skincare ingredients, this is really arguably the most important thing for you if you're suffering with breakouts, is to look at the base formulation. This is so important. So you want to use products that are really low, not only in oils, but also silicones. So that's, for example, dimeticon, cyclometicon. And this is where most people and most skincare brands for breakout prone skin go wrong. So they might even take out the oils, because that's kind of known now, but it's full of silicones. It's extremely difficult to find products without silicones or with low silicone level, actually.
Yeah, especially if silicone gives you that sort of luxury treat feel. It's that thing that makes a cream feel really smooth. And so it's an easy way to make skincare feel like a luxury experience, isn't it? But
absolutely. Yes, absolutely. It makes it feel really nice, but it's not a good ingredient. I don't really rate it, and especially if you're breakout prone. And it is such an easy way of make it feel silky. And I always say it's the lazy cosmetic chemist's trick, in a way, to just chuck in a lot of silicones and then it feels automatically nice, but you are clogging up your pores with that. And you're also hindering resorption of active ingredients from skincare.
Silicone is it's a barrier, isn't it? It's used in scar treatment to help scars heal. It is a medical ingredient. But so people should look for dimethicone and anything ending in cone or own. Is that right?
Yeah, cyclomethicone is another one. And if they are in the top half of the ingredient list, then I would definitely say no. So this is DeloRx is my new baby, so to say. So I've just launched the first product, which is a hybrid cleanser. And this is because after 20 years of looking after exactly this type of patient in clinic, I found that there's nothing for them available. There might be something that's marketed for this, but in my experience, it's not really suitable in the vast majority of cases. So the hybrid cleanser I just mentioned is cleansing your skin properly, but it is suitable for sensitive skin as well.
When you say hybrid, what do you, is it?
When I say hybrid, I mean that
as well as
those two aspects. So it's anti-aging. So it's the whole range really is really advanced anti-aging range, but also specially formulated for breakout prone skin and sensitive skin at the same time, which is usually you get one or the other, but you don't get two or three of them.
Yeah. And I know you've put 30-something% actives in here as well. So it's a treatment as well as you know, a wash, isn't it?
Yes, so the level of ingredients, and this is on top of the actual wash active and substances, is really unheard of in a cleanser. And so that we have enough time to speak about questions, I'm just going to whiz through the ingredients. So 5 of those ingredients. The one is a salicylic acid, which is great in clearing your pores, but it can be really a problem for sensitive skin. And that's where the second ingredient comes in, which is Simsitive, that helps you tolerate salicylic acid. So it's a neurosensory soothing ingredient, really amazing for reactive skin like rosacea. Wow. Third ingredient is a very strong antioxidant. It's organic white tea extract. White tea is the younger leaf of green tea plants, very high in antioxidants. And the fourth ingredient, alpha bisobolol, is the molecule that makes chamomile soothing. So it's that is the active ingredient that is the soothing part of chamomile. So this is, again, very anti-inflammatory. And then lastly, a very, very high concentration of organic cucumber hydroxyl, which is essentially organic cucumber juice.
You can smell it in here. I don't know if anyone's had a chance to try this yet, but it has this lovely fresh cucumber smell.
Yes, yes. The product is actually fragrance free, which was important to me for allergy reasons. But it does have a really nice fresh scent.
Does feel like a treat. So James has tried it. Yeah, how did you get on? Let us know.
So we're just coming out now. And I kept this free of things that I consider an issue. So I don't really like the term clean, but for what it's worth, it is a clean product in what I think from a dermatology point of view is clean. And then this is the other products that will come out over the next year, really. And this is what everybody should be using if you have breakouts or not, just really looking after your skin. So after cleansing in the morning, you want to use a high-grade antioxidant serum and then an SPF moisturizer. In the evening, after cleansing, if you have irregular pigmentation, you use an anti-pigment product. And then from age 30, I would say, everybody should be using a matrix stimulator. So this is something to stimulate collagen and elastin. And then if you need to, you can add a hydrator on top. But for some people, the product, the matrix stimulator might be sufficient.
And that's a retinol, you're saying, the collagen stimulator?
It can be a retinol, or if there are other matrix stimulating ingredients, such as certain peptides as well. Yeah. But retinoids are great for breakout prone skin as well.
Even if you have sensitive skin or rosacea, because I know some rosacea friends of mine, they don't use retinol, but maybe you have a...
If it's the right formulation, absolutely. And my retinoid that will come out in Q1 is one of those. So it has been just actually passed all the testing specifically in sensitive skin. So it's an 0.5% retinoid, which is a really powerful concentration, but there was zero irritation even in sensitive skin. So it all depends on the other ingredients, on the base formulation, on the actual derivatives used. And all of the products in my range will be not only ultra low in oils, but also silicones, really important, and will be anti-inflammatory as well and fragrance free.
So maybe James, that answers your question about, James was asking for a silicone-free and oil-free SPF recommendation.
Yeah, at the moment, to be honest, there isn't one. So just for now, you have to look for one where the oils and the silicones are lower on the INCI list. But I haven't actually found one yet. Mine will be, of course, fitting that brief. But right now, I don't think there is one. I mean, right now, until my products come out, one that I often recommend is the Heliocare range. They've got some really nice products which are which breakout prone skin gets on quite well with. They have oil-free
products in that range, don't they?
Yep.
Yeah.
Yes, they do. That's right.
Mm.
So for any more questions on the products, just go to the website, which is delorx.com, and there are loads of question and answers that we don't have time to discuss today.
Is this designed, just want to leap in, is this designed for daily use, or how often should you use this?
It depends on the product, but generally, yes, absolutely. But what I would always recommend to anybody who who starts a new product, and especially if it's active skincare, to taper the products in. So, for example, with the retinoid, or any retinoid, in fact, what you do is the first 2 weeks you use it just twice per week. The next 2 weeks you use it every other day. And if you're still fine with that, then in the second month, you can try every day. And depending on your skin sensitivity and depending on the product, you might tolerate that. If not, don't worry. Then you just continue with every other day, or even just twice per week. Every little helps. So don't feel you have to go up to every day if you don't tolerate it. But I haven't yet to meet a patient, rosacea or not, who I couldn't get to use retinoids.
Yeah, and the same with this. Could you use this?
Yes,
you might have to
it's
build
for
up.
daily use. Yes, do start slowly to make sure you get your skin used to it, because it is a powerful product, but it is designed ultimately for daily use. Absolutely.
And if you're pregnant, can you use it?
It does contain salicylic acid, so I wouldn't recommend it in pregnancy.
Okay. So maybe that, yes.
And that's purely a precautionary principle. I mean, I honestly don't think it would get into your bloodstream, because it's a cleanser, and it's a skincare cleanser. It's not a prescription product. But as a general rule, we always say anything with salicylic acid you should avoid in pregnancy, really.
Interesting. Yeah, thank you. Does anyone have any more questions about skin in general? Oh, James said, Dr. Stefanie, could you please share? Oh, sorry. Yes, we've shared the products you use in your. Have you shared the products you use in your current skincare routine?
So in my personal one, what I use is the following. I start and end the day with cleansing, obviously, and I use the DelorX cleanser also, obviously, because I literally designed it so that it's not only perfect for you, but also perfect for me, because I have exactly that target skin problem. Then I use in the morning an antioxidant serum. At the moment, because mine is not out yet, I use one by SkinCeuticals. And there are two options for breakout prone skin by SkinCeuticals. One is the serum 10 AOX, which I would always start with because it's very gentle. And if you are okay with that, then you could potentially go up when you run out next time to the Floretin. So that's your antioxidant. And then you could on top use, for example, the HelioCare. In the evening, cleansing again. And if you wear makeup, James, maybe not you, but if anybody is wearing makeup, you can start with a micellar cleanser to take that off. That's fine. But never just use a micellar cleanser on its own. It leaves a film on your skin that contributes to breakouts. So you want to
always wash mine off. Yeah.
Yes, absolutely. Start with a micellar product and then do your proper cleansing with water and just your hands. You don't need any gadgets or cloths, or just your hands is absolutely fine. So evening cleansing, and then I use at the moment I use a prescription retinoid a couple of times per week. It's called Ketrel cream, again because my own one is not out yet. Once it is, I will change to that. And on the other days I'm using a moisturizer, anti-inflammatory moisturizer by Neostrata. Again, it's called Retinoid Neutralizing Serum. They call it a serum, but really it's more like a lotion type consistency. So that's my personal skincare regime. And I use, when I use makeup, which some days I do, sometimes I don't, I use Oxygenetics Acne Control, which is a nice acid one.
Yeah. Have we got time for one more question? Nadia's saying, what would you recommend for thinning skin age 45?
This is a really good question. So retinoids have this myth that they thin the skin, and it's not true. So for thinning skin, you definitely want to use a retinoid. And don't worry that it thins your skin. It does not. What it does, it thins the dead horn cells on top of your skin. So the stratum corneum, the horny layer, it actually thickens your skin, your living skin. So it thickens your dermis and your epidermis as well. So retinoid is an absolute must for that age and thinning skin, because it thicks your living skin in a really nice way.
And if somebody was starting with their retinoid without seeing a doctor necessarily, what would be a good starter, do you think?
So it's always very, you can't really compare concentration. So one company, 0.3, is a very different from a different company, 0.3 retinoid, with regards to derivatives, but also depending on what other ingredients, what base formulation.
Yeah.
So, you know, I would always say, choose a product choose a gentler product, but always taper it in with this intermittent use, so what we call retinization of the skin. And that's the more important principle, really, that you start with intermittent use and bring it up very slowly, rather than thinking, oh, this one sounds on paper gentler, but it might not be the case, because if somebody's using retinol instead of instead of retinol palmitate, for example. So the most commonly used one is retinol palmitate or retinol acetate. Those two are very, very, very gentle ones. So if they are 0.3%, then they are way less irritating than 0.3 retinol or retinaldehyde. So it's very difficult to compare different brands.
Yeah, maybe a consultation with a skin specialist would be called for, just to get the right one and make sure you're not wasting your money.
Yes.
We do have some more questions. I realise we're at 7:30. Stefanie, I do know that I think you're free to take more questions. If
I'm
to
fine.
Go, thank you so much.
No, I'm completely fine to continue.
Okay.
I just wanted to say something about the consultation that you said. I think that's a really important thing to say. And just make sure that if you suffer with breakouts, I've just heard so much bad advice from you know, high street spas or so on with regards to breakout prone skin. You cannot use rich products if you're breakout prone, even if your therapist says you need to because you've got dehydrated skin. It's just not true. So ideally, come and see. Well, of course, if you're in London, you're very welcome to come and see us at Udello. If you come for a facial, you will get skincare advice with a written regime at the same time as well.
Yeah, that's really important, because maybe the investment in a consultation will save you sort of months, years of sort of misspending on the wrong skincare, and also potentially, you know, breakouts, which all, you know, skin flare-ups. As I now think, inflammation, I've possibly got it and I didn't even realize through overloading my skin.
And what I hear very often actually is that patients, when they come to see me for the consultation and they say, oh, I've got dry skin or dehydrated skin, but also breakouts, and then they're using all these rich products, and then I change their skincare regime to very much lighter products plus anti-inflammatories, and then they come back after 3 months, and then what they all say is that I can't believe I'm using much lighter products, but my skin is so much less dry now.
Interesting.
This is just the most typical report I get after 3 months.
Oh gosh,
so
I need to come and see you for sure.
Yes, do that.
How long do you advise working the cleanser in before rinsing?
So this is very much depending on skin type, but I wouldn't leave it on too long. It's a very, very powerful product. So start with just always wet skin. It doesn't foam really, but kind of foam it up between your hands, wet hands, and then massage it onto the face, maybe 30 seconds, and then rinse it off with lukewarm water. So really important to apply on wet skin, not dry skin, and to rinse it off. And you start with just really kind of on off 30 seconds or whatever, however long it takes you to apply it, massage it in. And then depending on how robust your skin is, you can then possibly increase the time. So if you, especially male skin, which tends to be more robust than female skin on average, of course there are exceptions, you can then leave it on for a little bit longer. But whatever you do, new product or increasing the time, always do it slowly and gradually and see how your skin is getting on.
Yeah, brilliant. James would like some advice on acne due to a condition that I can't pronounce, but maybe that might be something to
have a look.
see you in a consultation for.
I'm just looking at the chat right now. Acne for dehydrated. Sorry, I'm just looking for the question.
Folliculitis.
So I can't see that question, but folliculitis usually needs prescription treatment if it is really folliculitis.
So James, that might be something to see Stefanie for separately.
Yes, definitely. You could try and use something like, for example, Clinicept spray, which is a very good skin antiseptic. But generally, with that sort of problem, you'd need a medical consultation and very likely prescription cream.
Yeah, okay, brilliant. Thank you, everyone. I think we're out of time, and I can see those questions coming, which means we have to invite you back for another session. I mean, clearly, these are the two biggies of skincare, of skin issues, aren't they? Sort of looking after our skin properly as we get older. And as you said, teenage breakouts are completely different in cause and in presentation and the way you treat them to adult breakouts, but there hasn't really been a range that treats both of, or looks sensitively at both of those things.
Yeah,
can be
absolutely. And there are ranges that market both, so that you do have ranges where it says for this type of skin. But have a look at the INCI list, and I bet you will see silicones in the top half of the list.
Yeah,
it's just not suitable in my professional opinion. After more than 20 years of looking after these patients, is a massive problem, silicones in this type of skin.
Really, yeah. Well, brilliant. Thank you, Stefanie, for giving up your evening, sharing your advice. Thank you to everybody who joined us. If you missed some of it, or if you'd like to hear it again, we will be sending you the recording tomorrow. I do hope you are enjoying your Dello RX, and Stefanie, I can't wait to see what all these other products are going to be like, especially the anti-inflammatory moisturizer, which I now know that I need, or very likely. Thank you so much. Thanks, everyone.
Thank you so much for having me, Victoria, and thank you everybody for coming and your really interesting questions.
Yeah, thanks,
and
everyone.
I might speak to you soon.
Thank you. Have a great evening, everyone. Thank you.
Thank you. Bye-bye.
Bye.